Hello, my name is Dr. Art Rastenhad, and we're here today to discuss how to set up for a transperineal prostate biopsy in the OR using our MR ultrasound fusion biopsy system. The first thing that we'll be reviewing for the setup is how to position the items on the table that we use to perform the biopsy. This will include the stabilizer bar, the stepper, the stirrups, and the field generator. For the first part of this today, we're going to go over how to attach the mechanical devices to the table that we use for the fusion biopsy. They're usually stored on the back of the UroNav biopsy device right here. This is the stabilizer bar, the bar we use to hook the stepper to. It slides on the end of the table. This is the first thing we attach, and it should be at the very end of the table. You must stabilize it with these screws. And it anchors to the table. It should not move. All right? It should be stable. You should be able to shake it and it doesn't move. These are tightened. This typically sits here and is anchored in place at a 45-degree angle and hangs loose for the setup for the procedure. Lastly, notice these are the same. There's a screw that holds it on here. Sometimes these become loose and pop off. There's a spring, a screw, and this piece. You must find them all or we lose these and then it becomes just a straight ratchet. We really want to keep all the pieces of the stabilizer bar together. See here, this is one of the attachments to the table. If you ever remove it from the stabilizing bar here, there's a white piece that falls out. You must not lose this. If it does fall out, it's easily replaced by sliding it back in the slot here and positioning it to allow it to go back on the stabilizer bar. If this piece is lost, you'll never be able to anchor this back to the table. Next, we put on the Bumblebee stirrups for the patients to be positioned in the dorsal lithotomy position. We slide it on and slide it back to the end of the bar. There has to be enough room for the Bumblebee stirrups to sit on the bar. And we slide it up right up to the edge. Also stabilize this so it's anchored on there and positioned in a typical position for the dorsal lithotomy position. We usually slide the bar up here for most average people's heights. And that works very well. The Bumblebee should be stable, and we do that on the other side as well. And there should be enough room for the stabilizer bar and the Bumblebees to be placed on the OR table. This portion we'll be discussing the field generator. It's how we keep track of the biopsy device inside the patient in 3D space. It's the most important piece we have, and also if you bang it, it will break. We have rotated the table so you can see how we attach the field generator. Above the Bumblebee arm on the bar, we'll be placing it right here. First step is some type of post anchor for the table. And then you remove the field generator hanging on the back of the fusion biopsy device. The post goes in the hole and really anchor it. It should be up straight up and down. And now here's the key. There's a lot of different ways to put the field generator into position. We like to put it inside the Bumblebee to allow it to sit in this position on the side to track the stepper. Some people put it above the patient. We really like to have it like this on the side. It allows us to do the biopsy as well as focal therapy, because if it's on the side, we still can do a cysto and have access to the penis and scrotal area. Here's another view of the same positioning. The field generator is off to the side. Right here below the stirrups, tucked on the inside, it's out of the way. We're going to be going over the patient positioning and a look at how we have all the devices in place to allow for the patient to walk in the room, disrobe, open the back of the gown, and sit down on the edge of the table. Justin is here to help me today. Say hi, Justin.
How you doing?
All right, Justin, come on in. Pretend you're the patient. I'll pretend I'm the nurse doing your job and you're the patient today. Please come in, sir. Turn around. Face me. Make sure the gown is open in the back. We're going to sit on the edge of the table. I tell all the patients Just watch your shoes. I tell all your patients that please have your scrotum hanging off the edge of the table, because when they lie back, they're going to move farther up the table, and you're going to have them scooch down. So Justin, lie down. Put one leg up at a time in the stirrups. Now, if you look, he's moved up the table. He has to come down to the edge of the table. This is very important because if you position the patient too far up, we can't do a fusion biopsy. So Justin, wiggle down for me. A little more. Oh yeah, perfect. So if you come around and take a look, he's at the very edge of the table. This allows us to set up everything for the case when the patient's here. And another key point, when we have the patients in the stirrups, we ask them why they're awake. We flex their hips back. Does that hurt at all? So it's important to check this while they're awake to avoid any soreness after the procedure. We'll be going over the quick setup for the UroNav device itself. The first thing to understand that the UroNav device has two sets of power plugs. These need to be plugged in, okay? Now, a common problem is after you plug it in, the monitor doesn't come on after you hit the power button right here. The reason is this cable is typically loose, and in this case it's actually out during the demonstration to show you how common it is. When you rotate the screen, this gets yanked out and it won't turn on. Moving on to other cables that are important. This USB port here is for the foot pedal. The foot pedal during the case is always placed inside a plastic bag, and this allows it to keep the blood and betadine and other things off it to make it easily clean for the next case. The other thing is these are called trackers. These pieces are used to track the 3D equipment. If you're the nurse in the room, the cleaning staff is supposed to wipe it. I recommend re-wiping before the case starts to make sure any blood or betadine that could have been missed has been done and cleaned correctly. These are the plugs that go into the UroNav device. I'll show you. The way they work is that they recess by pushing back to remove them to remove the lock. If you twist them in the device, you'll break them off. Looking at this, you see the black line, lines up, faces you, plugs in. Again, the black line, faces you, plugs in. And during the case, before the case is ready to go, we hang the trackers over the edge of the stabilizer bar here to allow them to be ready for the physician. The other piece is what we mentioned earlier, which is the most expensive and fragile part of the device, is the field generator. The field generator cable is seen here, has a red dot on top to align it. There's small pins inside. If you bend this, force this, you'll break this as well, so please be careful. It goes in right here next to the trackers. All of them point in the same direction towards the front of the device. Finally, all the UroNavs are networked. You must plug this into the corresponding Cat5 jack on the wall to be able to download and upload cases after the case.
I'm Beatrice Felix, CST.
I'm Dr. Art Rastenhad, and we're back. We're going to be setting up the OR table for the case. It's a very simple setup. We don't use a drape. We use blue towels that we position on the stepper as well as on the patient, and then we have two parts to our table. Everything is set up sterilely in the beginning. This part with the blue towel here outlines where the nurse exchanges the pathology specimens, because we dip the needle directly into the formalin, and then we'll show you our wash process in a moment. So let's get the table set up. This is our barred biopsy needle, 22 millimeter sampling, 18 gauge. This is what we use for all our procedures. This is a 22 gauge Chiba needle. We use this to numb the skin. Some doctors will use this other needle we're going to show you now. This is our 20 gauge spinal needle that people use for numbing the prostate and doing the prostate block as well. This is our 22 gauge, 2.5 inch needle for numbing the skin and the prostate block with two 10 cc syringes. This is the Civco biopsy grid. We use this for the procedure. It's important to notice that this has fewer numbers and fewer letters. It's A through G. This is the part we use for the fusion biopsy device. If you turn around and look at the other side, there's much more letters and more numbers. This is not what the device is calibrated for. So please remember, if your doctor has problems and things don't line up, he's using the right side of the grid. At the conclusion of the case, we have one small piece of Telfa and a Tegaderm. We use a little bit of bacitracin. The thing that we do is the bacitracin is placed on there, and the remainder of the tube is sent home with the patient to allow them to use that for their skin care after the procedure to hopefully decrease any inflammation at the level of skin where the needle punctures were. We have 2 buckets here. Typically the first bucket is sterile water. The second is filled with betadine. You may dilute the water to fill up the betadine level. And the thing that we do with this, it's important, is that we take the specimen off. We'll show you that in a moment. In the formalin cup, it's dipped in betadine and then rinsed with sterile water and then reused. This decreases our risk of infections during the procedure. We're going to go over the quick table setup for the preparation. As you see here, it's very basic. We don't use drapes for the table. We use the blue towels to cover the stepper and cover the patient's scrotal area between the prep space. Quickly in inventory, we have gloves. The grid plate, notice that the letters are A through G. This is the correct side that should be facing the doctor. Post-op or after the biopsy, we have bacitracin here, a Telfin, a Tegaderm. The remaining bacitracin tube is sent home with the patient so they can use that for care in the area where the biopsy was done. Here you have 20 cc's total of lidocaine. We use this for the procedure. You have a short needle for the skin and pelvic floor muscle blocks, as well as a deep prostatic block. We use a 22 gauge Chiba or a 20 gauge spinal needle. Here's our barred biopsy gun, some 4x4s for wiping or cleaning during the case. And the most important thing we have is we have 2 buckets here. The first one is sterile water, the second is betadine. After we wash the specimen off in the formalin cup, we wash the needle tip in the betadine, followed by sterile water, and then perform the biopsy core sampling again. We'll be going over the basic setup for collecting the specimens. We have our pathology sheets. Every core is in the same order, 1 through 12 or 1 through 20. We use a modified Barzell template. They're all listed down here, and this will be provided for you. There's a 12 core setup and a 20 core. Typically we're using the 12 core setup. Cups 13, 14, 15 are the additional cores or cups that we take, and these are done for MRI target lesions that we see on the MRI that we're sampling in the OR. We have our setup of 12 cups and then a 13th or 14th cup needed for the fusion biopsy specimens. This is the stepper. This is what the ultrasound probe is attached to. This is one of the most common areas pieces are missing from. Just an example, notice that these screws are not the same because we've lost screws in the past. They all reverse thread, so to tighten them, they go towards you. At the end of the case, you spray this down with the enzymatic cleaner and send this down to your sterile supply for whatever processing you're doing at your institution. The other things that are really important, if you look here, there's a black screw. This gets lost because it's used to loosen to remove the ultrasound probe. I'm going to undo it and show you what happens. And most people don't realize they'll have the screw, but they're not paying attention to look what happened. The black piece falls out and no one ever sees this again. The way to put this back is pretty simple. There's the opening for the screw. We slide it in the front. There's an opening right here in the hole. We slide it back in the slot that it fell out with. We hold it with our index finger gently and use the screw to line it up to anchor it back in place. And I can't tell you how many times this happens. It's okay that it does happen, but you have to understand how to recognize it and put it back into its place. Other things to understand, the stepper itself comes out. So when they clean it, this extends and retracts just by pushing, okay? Another part. Sometimes when they clean it, they don't put it back together correctly. This is the release for the back of the black cover. This is what holds the pieces together, because now this would slide out forward and you have a ring inside, which is what controls the rotation of the device. It locks and stays in place. I'm popping it out just so you can see. And these are the pieces that you have to understand that can fall apart and have to be put back together. This has a center point here that locks in place, as well as a slide or a track. All we do is slide that back in. There's a little hole where you can see it lines up and pops in the hole right here flush. We slide the ultrasound arm back into position. The black piece slides over the back. The white knob we pull down, it slides forward, and we lock it in place. Now the stepper has been put back together. This is the ultrasound probe the 8848 probe used with the BK ultrasound. The probes can differ slightly, depends on which machine you have, but the setup's the same. We open this and we usually assemble the stepper and the ultrasound probe in the same location. Remove the top cover and set it down. This is our ultrasound probe. The most important thing when you look at it is the metal spike here present, because sometimes these get broken off, and you want to look down to make sure that it's straight and not bent, because if they heat it, it can be bent. Another thing to look at is the cable itself. If it's vacuumed and sealed and this is attached here when it was cleaned, it will break the ultrasound probe and it'll be not usable. So it's important just to check before you start using it that you see no external damage. Now we have to set up the probe for attaching to the device. I'm going to get the endocavity balloon and the sterile water to show you how to put this together. And another thing, we just set it down right there for me, please. All right. This is the next step. It's important. This is what we call blue for the poo. We use ultrasound jelly in the rectal vault to help us see better. But we set it up now and remove the air from the ultrasound jelly so there's no air artifact when we do the procedure. So we open up the end of this. We fill this with ultrasound jelly to about 50 to 60 cc's. Now, as you can imagine, when you put the top back on the ultrasound, there's going to be air stuck in here. So you can hold the end of it and give it a shake. And this causes all the air to travel up. We degas it. I typically just let it shoot out, try not to make a mess. And now we have an ultrasound tube filled with about 45 cc's ultrasound jelly. The reason I did this at this point is that then we add a little bit of ultrasound jelly to the endocavity balloon as seen here. This is all you need to be able to slip your probe on. We put a little jelly on the tip of the probe and we're able to attach it. Another little trick, if you have trouble attaching the balloon because you want to open up this space right here, I use sterile water, which we use to put for the balloon, as a counterweight. So as I pick up the ultrasound probe, we put it in upside down. So this is the transducer here, the buttons are down, the connecting tubing is down, and I'm holding this with my left hand, this opening. It slides in, we pull it, it's upside down the whole time. Now the reason for this is, as you turn it over, there's no air here. This is key, because ultrasound doesn't go through air in the setup. The next part of the process, we slowly inject the water. This distends the balloon. As you see, the air in the balloon is here. There's a big bubble at the top. I release my thumb and the air travels out. Other tricks is that you can hold the probe with your pinky. Refill and gently tap with your finger. You don't tap the probe against metal or hard objects because you can break the crystal. And then we remove any additional air. At the point this is complete, I close the valve. I degas the syringe so there's no air in it, and reconnect it. The ultrasound probe is ready to be attached to the stepper. The stepper isn't considered sterile because it's a clean procedure or a clean area at this point. And again, we have the stepper. All right, we're back at the stepper now. I've orientated so you can see from the side. Remember the metal spike that I mentioned earlier? This is laid into the stepper. But before we do that, you have to slide the ultrasound probe into position because the tube is fat at the bottom. This metal spike here will fit into a small little hole and lock into place. It snaps in. I'll show you the hole from the other side. The next trick is notice that I use two hands. I line up this the tubing from the balloon through a little tunnel inside the cavity. And this is why when I mentioned earlier it gets lost, is that people unscrew this thing and it falls off at the end. So now it's locked in place. But how do you know you did a good job? First, we look on the other side. You see here, this small little hole here is the location where the spike has locked the probe into its orientation. If it's not in here, it's not in place. Second check is that you can look down the front of the ultrasound probe and see that it's seated perfectly around the metal holder, or the carbon fiber holder, which we call the stepper. So this is all set up, and I want you to take a quick look. You see this little keyhole here? This is where the trackers are placed to track the device in 3D space during the biopsy. Those are those cables that I talked about wiping before in the earlier part of the video. And the second place to place them is here on the left side. Those are where the two trackers go. The physician doing the case should know this, but I just want letting you know so you have some understanding of how everything fits together. This is the back of the ultrasound machine. Doesn't matter which version, they all attach in some way right down here. Looking down here, you see this is a DVI cable to an HDMI cable. Some sites may use S-Video, which that connectors are up here. You just have to pick the one that's the output for the machine. The important thing is to notice that this must be tight and secured in place. This HDMI cable comes over here and attaches to the highest HDMI cable right here, the one closest to the top, and slides in. So we've just connected the ultrasound to the UroNav. It's important that this creates the picture, this receives the picture. So if you do not connect it, there will be no picture for the case. All right, first we take the ultrasound that you set up and connect it to the ultrasound machine. Realize, please be careful that not to yank the ultrasound probe off the table where you set everything up. This can be waiting for the doctor to come in. He's going to grab this and bring this over to the stepper and stabilizer bar and slide it into position and lock it. I'm going to tighten it in place so it sits here, all right? Now it's in place and sitting here. The patient's been positioned and they're asleep. The last step, which sometimes people forget, is they still have to connect the trackers. We talked about this. I showed you in the prior video. They go into place and click in. There's a small little key notch on this that lines up with the space that I showed you before. And if you look, it just slides in, locks in place with an audible click. And that is how we set up for the procedure. This is a typical setup and layout of the room once we've attached all the devices and we've gone over the other items that I discussed earlier in the video. I think it's important. The ultrasound machine lines up at the very bottom of where the stepper is. The UroNav device, the corner of the computer ends up at the end of the bed. This gives us enough space for an assistant to help use the UroNav device while it gives the physician access to the ultrasound to perform the biopsy. On the floor you see the foot pedal, which has been bagged. That's available for the physician's left foot to use that during the procedure. This is an example of us obtaining the prostate biopsy. You hear the biopsy gun is fired. Now notice we have 3 bowls on the table, 1 cup and 2 bowls. The cup, the nurse confirms the name of the target and the number of cores you're planning to put in, and that label should be present here. The doctor takes the needle, opens it up, and stabilizes the needle. Dips it in the formalin, the core falls off. No nurse should have their hands in the field because you don't want anyone being stuck. Once this is complete, the needle's locked, rinsed in betadine, rinsed in sterile water, and repeat. No one should ever touch the needle in the first 10 centimeters of the needle. This is what has to maintain sterility during the case. Nothing else is as important as this fact because this is the only thing that touches the patient. And it never goes in more than 10 centimeters. So it's a great place to hold and stabilize. Notice that I'm wearing sterile gloves. This is the only area that we try to maintain sterility with the biopsy device, the formalin cup, because we know formalin, there's no bacteria that grows in formalin. Betadine cleans and sterile water rinses off the betadine before use with the patient. After the biopsy is complete and the dressing has been placed, I think it's really important to understand how we take apart the ultrasound probe and put it down to sterile supply to be cleaned. Now the reason we do this is that we only typically have 2 probes at most sites. So the first thing that leaves the room is the ultrasound probe, and we're going to show you how to do that right now. So first, we remove the 2 sets of trackers that I talked about. These 2 trackers here. This is what I talked about, making sure the nursing staff wipes it before the case starts, and your cleaning crew also wipes this down. We hang this over the edge right here so it's easily accessible and that no one steps on it. All right, next, you can leave the stepper in place. We undo that screw I talked about that everyone loses. Unclip it. It opens up. You see how it's nice and open? Grab the front of it and slide it forward. we bring it over here to the probe. You can remove the cover and throw that in the garbage. Leaving this here, make sure it doesn't fall off. Remove it from the BK ultrasound machine, put the cord back in the same tray that it came in, and we can have this removed from the room and sent down to be cleaned. Next step, after you've done this, we take this, remove the stepper, we slide it back, and we place this on the table over here where the nurse sprays it with the enzymatic cleaner prior to sending it downstairs. Now lastly, this is the key. Because this stabilizing bar does not come off very easily, we have to use a stand for the patient's legs. So we unscrew this and loosen it, it falls down, and that's out of the way. And we're going to show you how we bring a stand in to support the patient's feet. While the patient's still asleep or just waking up, we slowly lower their legs and stabilize it on this stand here. We have usually typically 2 pillows, everything is padded, the stirrup is removed, so we're able to bring the bed in. At no point should anyone leave the patient's legs at this point because this is a moving stand. All right, the bed comes in, the patient's rolled off to the bed, and we rinse and repeat and do the next case. I'd like to say thank you for taking the time to watch our video on how to set up and break down for a transperineal biopsy. I really like to extend a big thanks to Justin, our patient model and nurse for the day, and Beatrice, our surgical tech. Without these people involved in the care of our patients, we would not be able to get this done and get it done efficiently. Thank you. All right, all right, all right.